So coming to our new physiochemical property, that is viscosity. Viscosity is actually the resistance between the layers of the fluid to flow. So now consider these are layers of the fluid, and all the fluids can flow easily, right? So if there's attraction between these layers, what will happen? The resistance will be larger. As a result of it, the fluid will not be able to flow easily. Compare the viscosity of water and honey. What happens in water? The attraction between the layers is very less, so viscosity or internal resistance is very less, and water is easily flowable, or easily it can flow. Whereas honey, it has attraction between the layers is very large, the resistance is also very large, and it is difficult to overcome the resistance, so honey cannot flow that easily as compared to the water. So, as you know, in the beginning, we studied about two type of colloidal solution, lyophilic and lyophobic. And the lyophobic ones, there was no interaction between the disperse and the dispersion medium. But in the lyophilic ones, there was interaction, or there was attraction. And this attraction, it hinders the movement. So, lyophilic colloids have higher viscosity as compared to the lyophobic ones. Unit of viscosity is dynes per centimeter square, or normal it is poise. Or it can be given by the formula pressure per unit area, and in the CGS system the unit of pressure is dynes. So A is area, that is normally millimeter square, it comes out to be centimeter square in the CGS system, so it becomes to be dynes per centimeter square. Now application of viscosity, very easy. As you know, blood, it is 4 times more viscous as compared to water, and plasma, it is 1.5 times more viscous as compared to water. So viscosity of the blood, why is it water? Why is it greater? Why is it 4 times greater as compared to water? It is because blood has red blood cells as well as certain plasma proteins, and these plasma protein and blood cells, they have affinity with the fluid content of the blood, as a result of which we have greater viscosity of the blood. As blood flows to the capillary, its viscosity decreases, and in case where is polycythemia, the red blood cells increase, what will happen? The viscosity will also increase. But in anemia, what will happen? The amount of the red blood cells will decrease, as a result of which the viscosity of the blood will also decrease. More viscous blood increases the cardiac workload, it increases the peripheral resistance. When there is resistance, the blood flow is hard, or it is very difficult for the blood to flow. But when dehydration occurs, what happens? Water content, it moves out. So consider this as your blood. There are a lot of cells, but the cells have fluid within them. When there's fluid, it allows the cell to move through easily. But what happens in dehydration? This fluid moves out. So what is there? The red blood cells, or the cells, or the plasma proteins, they are very difficult to move. Hence, the viscosity of the blood increases in dehydration, increases in polycythemia, and increases with the increase in plasma proteins and suspended red blood cells. Now, viscosity change in the muscle. As you know, actin and myosin are responsible for muscle contraction. So, what happens when there is interaction between actin and myosin? As you know, what happens with attraction? Whenever there is attraction, there is more resistance, and whenever there is more resistance, there is high viscosity. So, excited muscle is more viscous as compared to a relaxed muscle. Now we have vitreous body. Vitreous body is actually an amorphous body that is located in the posterior chamber of the eye. It is rich in albumin and hyaluronic acid. Since albumin is the plasma protein and hyaluronic acid is a substance having negative charge, so what will happen? It will cause the viscosity of the vitreous humor to be greater than the normal fluid of your eye. Now we have synovial fluid. This is actually a fluid which is present in our joints, and is great, it has greater viscosity as compared to the plasma. Why is that so? Because it contains hyaluronic acid, negatively charged substance which has affinity with water, and it helps in the lubrication of joint. It helps to provide a medium which allows the joint to move easily, like oil does lubrication of the machinic parts. The synovial fluid does the lubrication of joints of your body. Let me explain the surface tension phenomena. It's going to be very easy with one diagram. Let us read what is given over here first. A molecule in the interior of a liquid is attracted by other molecules in all directions. Look at this diagram. So, molecule on the interior is attracted by other molecules which are present in all the directions. So, it is being attracted in all the directions, whereas a molecule on the surface is attracted only by downwards and sideways and not upwards. So, this molecule on the surface is attracted only downwards and sideways and not in the upward direction. Due to this phenomena of the molecules present in the surface not having any attraction on the upper side, the surface layer it behaves as a film or as a stretch film. Surface tension is the force which molecules on the surface are held together. It is expressed in dynes per centimeter, that is, pressure per unit length. Surface tension decreases with increase in the temperature. As you know, with increasing temperature, the amount of the forces that are being exerted, they decrease, and also you can say that the attraction also decreases, as a result of which the molecules are easy to move out. Also, when what happens with water, when it boils, the surface tension decreases. As a result, the water molecules can move out very easily from the surface of the water. So, increase in temperature decreases the surface tension. Now we come towards the applications. Digestion and absorption of fats. As we know, boiled salts, they tend to reduce the surface tension. They reduce the force that is being exerted on the surface of a substance. They act as detergent, they cause emulsification of fats, and that is why fats are very easily absorbed in the presence of bile salts. But when bile salts are absent, the absorption of the fats is very difficult because the surface tension of the fat molecules becomes very much greater. Now we have a very important diagnostic test that we use in jaundice, and you will also study it in your practicals. This is a common laboratory test for the detection of bile salts in the urine of the jaundice. What happens is there in jaundiced patient, the amount of so we take the urine of a jaundiced patient and we take the urine of a normal patient. What happens in the jaundiced patient, the bile will be present, and bile is known to lower the surface tension. So what will happen if there are bile salts? We take urine of two patients, or we take urine of one patient, and to check whether the patient is jaundiced or not, what we do is we sprinkle certain sulfur particles on that urine. If the sulfur particles, they tend to settle downwards, what happens? There's bile present. The person is having jaundice, but if the sulfur particles stay on the surface, it means that there is no bile in the urine, as a result of which there is no jaundice to the patient, and the result helps in the diagnosis of jaundice via this urine test. Surfactant and lung function. We know that it is very much important. Now, in babies, what happens is in a certain age, a molecule or a substance called surfactant is produced. It actually lowers the surface tension and allows the lungs of the babies to expand and contract easily. But when there is no surfactant, what will happen? There will be difficulty in the baby's breathing, and such a baby will have surfactant deficiency or respiratory distress syndrome. This respiratory distress syndrome occurs in babies before 28th week of pregnancy. If they are born before 28th week of pregnancy, such babies will not have any surfactant produced in their lungs, as a result of which they will not be able to properly breathe after they are born. So we know that our lipids and proteins, they exist in certain different shapes, like they have different molecules. Cyclic proteins and cyclic lipids are there. So surface tension and adsorption phenomena, adsorption we are going to study a little bit later. These two phenomena, they help in maintaining the shape and they help in maintaining their structures. Lipoprotein complex membranes, the structure of the plasma membrane, it is composed of surface tension reducing substances, which are lipids and proteins. So these molecules, their plasma membrane is 55% protein and it is 25% lipids. These substances they decrease the surface tension, as a result of which the movement of the molecules into the plasma membrane or out of the plasma membrane is now easier, and the surface tension is now reduced. So, what is adsorption? For example, you consider a substance. As you know, we consider a normal example of a sponge. When it soaks water, it has absorbed the water. But when there are certain charcoal particles, they are or iron particles which are laid over the ground, and you attach the sponge on the particles will, what they will do, they will attract with the sponge, or they will become attached with the sponge. This phenomena of attraction or interaction, it is known as adsorption. They're not being absorbed, rather they are being attached with the outermost layer. This is adsorption. The capacity and the substance that is attached is adsorbate, whereas the sponge or the substance which is the main culprit or the main area providing the area of attachment is adsorbent. So in this case, the sponge will become adsorbent, and the sulfur particles or the iron particles they will become adsorbate. Adsorption is a dynamic process, it is a reversible process, and it decreases with the rise in temperature. As you know, surface tension also decreased with the rise in temperature. Same goes with adsorption, which also decreases with the rise in temperature. So, adsorption is very much important in the formation of enzyme substrate complex. As you know, enzyme and substrate they have non covalent attractions between each other. So, what is the attraction between the enzyme and substrate? That is adsorption. Action of drugs and poisons. On adsorption at the cell surface, drugs and poisons exert their action. They're actually being adsorbed, they're actually being attached to the receptors via non covalent processes. In analytical biochemistry, like in chromatography technique or separation and purification, we use adsorption phenomena. So it is enzyme substrate complex, it is very important in enzymes, it is very important in action of the drugs, and it is very important in analytical biochemistry like chromatography or separation and purification techniques. This is all from my side regarding the biochemical or physical properties.